Hi, my name is Jessica. I'm a registered nurse at a partner's facility in a cardiac care unit, and today I'm going to be talking to you about depression and abnormal psychology. Before jumping into the topic, please allow me a moment to talk about the clinical aspects of depression and how they impact patients suffering as a result of these mental health issues. Signs and symptoms of depression could include, but are not limited to, feeling sad, anxious, or empty mood, feelings of hopelessness or worthlessness, difficulty concentrating, making decisions, or remembering, changes in appetite, thoughts of suicide or suicide attempts. Even the most severe cases of depression can be treated. The earlier the treatment begins, the better the outcome and the more effective the treatment will be. Typically, depression is treated with medications, psychotherapy, or a combination of both. If these treatments are not effective and do not reduce symptoms, oftentimes other more invasive treatments are used, such as electroconvulsive therapy or ECT, and these are options that can be explored at that time. In addition to existing research on this topic, I've also gathered information by interviewing a social worker, Amanda Daines, on the topics of depression and abnormal psychology. She currently works in a detention center in Massachusetts for the Department of Corrections and interacts with individuals suffering with mental illness on a daily basis. I asked Amanda about her opinion on the most effective treatments for depression and mental illness. She stated, "Each treatment plan is individually based on a person's needs and goals. Not every intervention works well for others, and you must go through trial and error with treatment, exploring different therapeutic approaches to help a client best. Therapy and medication can work hand in hand for treatment." According to Simple Psychology, abnormal psychology is a division of psychology that studies people who are abnormal or atypical compared to the members of a given society. The definition of the word abnormal is simple enough, but applying this to psychology poses a complex problem. What is normal? To whose norm, and for what age or culture? The concept of abnormality is imprecise and difficult to define. Examples of abnormality can take many different forms and involve dissimilar features. At first sight, what may seem quite reasonable definitions turn out to be quite problematic. There are several different ways in which it is possible to define abnormal as opposed to our traditional ideas of what is normal. Throughout the class, we have had an ongoing question and debate of what is abnormal psychology and what the importance of labeling a disorder or individual as normal versus abnormal. Considering the significance of this question, I asked Amanda, why is classifying abnormal behavior so important? In her response, she states, "Classifying abnormal behavior is important to create the guidelines of what is considered atypical versus typical. Knowing that behaviors are considered abnormal and not just odd helps build diagnostic criteria and treatment plans. Classifying behaviors lies in the ability to recognize symptoms and formulate appropriate treatment." Of course, as we have learned in class, classifying abnormal behavior is important, but there are pros and cons as well. Amanda's thoughts are as follows. The pros of classifying abnormal behavior helps in developing a diagnosis and building treatment plans. At the same time, however, delivering a definitive diagnosis of mental health issues can cause a person to feel labeled and stigmatized. Some behaviors can be overdiagnosed, or there can be too many diagnoses depending on how the person presents at the time. Given this information, I asked what tools she typically uses to diagnose depression when it is suspected. The first thing she does is she usually uses the Beck Depression Inventory, or the BDI, which is an option used to help gather information. It's a 21-item self-reporting rating inventory that measures characteristics, attitudes, and symptoms of depression. It takes about 10 minutes to complete, and based on the questions if there's a rating scale at the end. Clients are required, though, to have at least a 5th to 6th grade reading level to be able to comprehend and adequately understand the questions. Once she completes the Beck Depression Inventory with the client, she then uses the DSM-5 to organize the information gathered, and this is the best way to determine if depression is the appropriate diagnosis. Once an individual is officially diagnosed with depression, I was wondering how receptive they are to treatment, so I asked Amanda. She said it depends on the person. When a person's newly diagnosed with depression, they generally take time to process this information. Learning to accept this information and knowing that it might define you as a person or not change anything at all. Therapy is successful when a person is open and accepting of therapy, change, and willing to work on their goals. Oftentimes in mental illness, many people go undiagnosed due to the stigma attached to the label of mental illness. I asked Amanda how she feels about it when, with mental illness, when it's finally diagnosed, if oftentimes the disorders are far progressed. She said that when someone first finds out that they are diagnosed with any mental illness, whether it be depression or something else, oftentimes they could be embarrassed, or they try and avoid their mental health issues, causing it to manifest into a bigger issue. Of course, all diagnoses must affect that area of functioning in order to meet the criteria. However, for a person to get diagnosed means that they at least had to reach out for assistance in some sort of manner. Oftentimes, though, it's not the person who has the mental illness who's reaching out. It's a primary care physician who notices the signs, and they can be referred to behavioral health clinics if their symptoms have progressed too far beyond the scope of practice of the primary care. Also, she said that stigma is only one portion of the reason why most people go undiagnosed. For other people, though, their symptoms may have become part of their everyday life, and they may not see anything as off or wrong. Although oftentimes it does become so advanced that they occasionally become acute psychotic breaks. So I was always under the impression that medication was the first line of treatment for depression or mental illness in general. So I asked Amanda, with mental illness as a whole, the first line of treatment typically leverages a medicinal approach. Is this your standing on the subject when comparing medications to other treatment options? She said usually when an individual seeks treatment for mental health, they would explore therapeutic interventions before moving towards therapies. There are many interventions such as cognitive behavioral therapy, dialectical behavioral therapy, and motivational interviewing that can be used to minimize a person's symptoms. Some diagnoses, although, will need medical intervention for stabilization prior to entering therapy, but medication should not be used as a long-term intervention. Every individual varies on how long treatment takes and how effective it works for them, and what works best for them in regards to pharmacotherapy, psychotherapy, and alternative treatments. I asked Amanda if there was an average amount of time between starting therapy and finding out what works best for them. She said there's no definitive timeline on finding an exact treatment. When a person initially begins therapy, they would go through intake and treatment planning. Then that person and their therapist would explore what and how they would like to work on. Before each session, a check-in review happens to see how well interventions are working. According to the National Institute for Mental Health, depression is a common but serious mood disorder, causing severe symptoms that affect how you think, feel, and handle daily activities. To be diagnosed, you must meet a specific criteria, and symptoms must last at least 2 weeks. Depression is broken down into major depressive disorder, persistent depression, depressive disorder, psychotic depression with seasonal affective disorder, and postpartum depression. There's a few types of medications that can be used for treating depression. They are tricyclic antidepressants, selective serotonin reuptake inhibitors, SSRIs, MAOIs, which are MAO inhibitors, and SNRIs, or serotonin norepinephrine reuptake inhibitors. SSRIs are the most common because they have the least amount of severe side effects, although they are often non-compliant with them because they can cause sexual dysfunction. Tricyclic antidepressants have fewer side effects and are less dangerous than MAOIs, but they have many unpleasant side effects such as cardiac dysrhythmias and anticholinergic effects such as dry mouth, urinary retention, blurred vision. MAOIs were the first drugs used to treat depression in the 1950s, but they found that they have many drug-to-drug and drug-to-food interactions, and they are hepatic toxicity, which means they are very toxic to the liver. So those are pretty much used as a last resort when other medications are not effective. So on the topic now of pharmacotherapy and psychotherapy, Amanda and I talked about alternative treatments for depression and mental illness. During our conversation, she stated that alternative treatments are used when the typical treatments are no longer having any effect. Some depression can be medication resistant and can lead to trying ECT. However, these types of treatments are to be signed off by a mental health provider, saying that there are no other options to help this person. ECT and TSM are both effective treatments for some mental disorders. However, they both require commitment. For patients using ECT therapy, they have to accept that they will have some memory loss, some of which may be permanent. TSM requires a patient to come every day for extended periods of time, which many people do not want to commit to. As you can see, there are many tools used to help diagnose depression, and there are different combinations of treatments. Treating depression can take time, but with the right treatment combination of pharmacotherapy, psychotherapy, and, if needed, alternative treatments, you can get better and cure your depression. Thank you.